the Kidswell project, supporting educators to ensure an inclusive learning environment for ADHD children. Welcome to all participants. Today we will focus on the mental health and well-being of children with ADHD aged 8 to 12 years. This is a developmental period during which academic demands increase and emotional challenges often become more pronounced. Our goal is to explore how we, as professionals, can provide meaningful and effective support for these children. The objectives of today's session are threefold. First, to understand how ADHD affects children's mental health. Second, to identify factors that promote well-being. And third, to discuss practical strategies that can be applied in both educational and therapeutic settings. Mental health does not simply mean the absence of difficulties. It refers to a child's emotional, social, and psychological well-being. It influences how children learn, how they relate to the others, and how they perceive themselves. Children with ADHD are at increased risk of anxiety, frustration, and low self-esteem. It is important to emphasize that these are not personality traits, but rather the result of neurodevelopmental differences and environmental demands. Between the ages of 8 and 12, we often observe intense emotions, difficulty managing frustration, and impulsive reactions. Many children feel that they are trying hard but not succeeding, which can place a significant burden on their mental health. Social relationships are often an area of difficulty. Children with ADHD may be misunderstood by peers or struggle to follow social rules. Social skills are not automatic. They require explicit teaching and ongoing practice. Repeated experiences of failure often lead to low self-esteem. Positive reinforcement should be specific and should focus on effort and progress, not solely on outcomes. Some factors that enhance well-being: warm, consistent parenting with clear expectations, positive teacher-student relationships, peer acceptance and friendships. Also clear routines at home and school, consistent rules and consequences, visual schedules and reminders, age-appropriate self-awareness of ADHD, the learning self-advocacy skills, and developing independence gradually. Also the support groups for parents and children, the access to community resources, and strong family-school partnerships. The role of the teacher in supporting is to use visual cues, reminders and timers, allow short movement or brain breaks, teach organizational and time management skills, to work closely with parents, school counselors, and specialists, to share observations and progress regularly, to foster an inclusive classroom culture, to educate peers about differences in an age-appropriate way, to help reduce stigma associated with ADHD, to observe academic and behavioral progress, to adjust strategies based on the child's needs, and provide regular feedback to the child and caregivers. Now the role of the scientist in supporting. Develop and refine diagnostic criteria and assessment tools. Improve early identification and screening methods. reduce misdiagnosis and stigma through accurate scientific evidence, design and test behavioral therapies, educational interventions, and parenting programs, research the safety and effectiveness of medications, produce research that informs best practices for parents, teachers, psychologists, and doctors, to provide scientific evidence to guide healthcare and education policies, to advocate for access to appropriate services and resources, and address misconceptions and reduce stigma surrounding ADHD. Emotion regulation in a child with ADHD can be achieved by helping the child identify and label emotions by using emotion charts, stories, or role play, encouraging talking about feelings, teaching calming techniques such as deep breathing, counting, and relaxation, practicing problem-solving skills, reinforcing appropriate emotional responses, avoiding harsh punishment, and using calm and consistent responses to emotional outbursts. Let's now watch a video about activities for kids for good mental health.
Hi friends! Today you will learn about the circle of control. The circle of control is a tool that can help you manage stressful situations, anxiety, or moments of overwhelm. The goal of this activity is to help you identify the things in your life that you can and cannot control. You can then focus your time, energy, and attention on the things you can control, while letting go of the things you cannot control. A simple way to start is by drawing a circle on a piece of paper. On the outside of the circle, write down some of the things in your life that you cannot control. And in the middle of the circle, write down some of the things in your life that you can control. Some examples of things you cannot control might include how someone treats you, how other people act, whether people like you or not, how other people feel, your past actions, world problems, or the weather. Some examples of things you can control might include how you treat others, how much you take care of yourself, your actions, your attitude, your words, the friends you choose to have, or how hard you work. You can also use the circle of control if you are going through a situation that is causing you stress or worry. Start by writing all the things about the situation you cannot control on the outside of the circle. Then list all the things about the situation you can control in the center of the circle. If you can't control the situation, then it is not helpful to dwell or worry, or to try to fix a situation that can't be fixed. Instead, you can free yourself from your worry and stress by doing one of three things. Number 1, acceptance. When you practice accepting things you cannot control, then you can focus your energy on things you can control. Number 2, letting go. Instead of dwelling on things outside of your control, it can be helpful to set aside or let go of these stressful thoughts. Imagine putting the things you cannot control inside a balloon and letting them float away. Number 3, using coping skills. If you find it challenging to accept or let go of things outside of your control, then it can be helpful to use coping skills to manage your thoughts and emotions. Coping skills can help you control how you react or respond to the situation. If there are aspects of the situation that are within your control, then you can use problem-solving skills to come up with action steps to reduce your stress or move you in a positive direction. If you are having trouble with problem-solving, don't be afraid to ask for help. A caring adult such as a parent, teacher, therapist, or school counselor can give you guidance. In conclusion, remember that you cannot control the weather. You do not go out in stormy weather and scold the wind, the rain, and the clouds. Instead, you build a roof and windows on your home. In a similar way, instead of getting upset at the world and other people around you, you can develop your inner strength to defend against difficult situations in life. You do this by focusing your time and energy on the things you can control and learning to accept, let go of, and cope with the things you cannot control. If you found this video helpful, please like, share, and subscribe. For more social, emotional, and mental health resources for kids and teens, please visit www.mentalhealthcenterkids.com. Thanks for watching!
Let's see some classroom strategies. Display a visual timetable on the board and review it every morning so the child knows what to expect. Sit the child near the teacher and away from doors or windows to improve focus. Same start of day and end day routine. Transitions always look the same. Countdown, music, visual cue. Short work periods, 10 to 20 minutes. Family support is very important when we deal with a child with ADHD. The family should learn all about it. Recognize that is a neurodevelopment condition and not a misbehavior. Establish clear daily routines, use visual schedules and reminders, keep instructions simple and consistent. Use praise and rewards for effort and good behavior. Set realistic expectations. Avoid harsh punishment. Validate the child's feelings. Provide a quiet, organized homework space. Break homework into small parts. Assist with planning and time management. Maintain regular communication with teachers. Follow through with recommended therapies or medication plans. Join parent support groups, promote physical activity, provide balanced nutrition, encourage the child's interests and talents. Allow age-appropriate choices and responsibilities. Let's look at some characteristics cases where support for students with ADHD is necessary. A first case is when we observe that the child is exhibiting emotional dysphoria. ADHD is strongly linked to emotional dysregulation, meaning difficulty in managing and expressing emotions. Low self-esteem isn't just a psychological symptom. It is a direct consequence of cumulative experience of failure. The child knows they face difficulties and develops performance anxiety before tests or assignments. Furthermore, support is needed when outbursts of anger occur. These outbursts are a form of overload, as the brain cannot process stimuli at a normal pace. Another case is when the child has repeated negative school experiences which directly affect well-being. Labeling a child lazy or naughty creates what we call learned helplessness. The child starts to believe they cannot change things. Constant reprimands and punishment do not help the child change their behavior because the child simply lacks the internal mechanisms for that change. Comparison with classmates is particularly dangerous for children with ADHD as it makes them easy targets for discrimination. Another area where support is necessary is to address organizational difficulties. Disorganization is not due to a lack of will, but to executive dysfunction, that is, a dysfunction in the brain's executive functions. Inability to manage time and assignments leads to chronic stress, and the child experiences a continuous state of defeat. The result of all this is mental exhaustion. The energy a child spends just trying to focus is excessive, leaving them psychologically drained. Another important area is support for social difficulties. Children with ADHD are characterized by impulsivity, which leads to unruly behavior, often resulting in exclusion from peer groups. Peer rejection and social isolation are among the most serious risk factors for childhood depression and anxiety. Support in this area must happen as early as possible. Another issue that exacerbates the situation is comorbidity. ADHD does not occur alone, but is often accompanied by other problems. 50 to 80% of children with ADHD have additional diagnoses: anxiety, dyslexia, oppositional behavior. Every additional difficulty multiplies the complexity of support. It requires a multi-level approach, metaphorically, It is like a system with multiple simultaneous faults. Children with ADHD have difficulty with change. That's why they need extra support when they face transition periods. Children with ADHD struggle with change. When they face transitions, like changing schools or moving to a new teacher, they go through periods of increased disorganization and anxiety. It is crucial to prepare children for these changes with pre-exposure, preparing them for what's coming so they can adjust successfully. In general, ADHD creates quite painful situations for children, which can lead children to withdrawal. This phenomenon is a red flag that the child has reached their emotional limit and needs immediate support. We see somatization of anxiety, such as headaches, stomach aches, and other physical manifestations of stress. What might look like indifference is not actually laziness, it is a protective mechanism. The child withdraws because they simply can't take it anymore. Let's now watch a short video that nicely summarizes some key points for understanding and supporting children with ADHD.
Any child can be inattentive, impulsive, or hyperactive at times. But a child who exhibits these behaviors frequently and severely may have attention deficit hyperactivity disorder, ADHD. Students with ADHD may struggle with starting and completing tasks, following multi-step directions, rushed and messy work, and restlessness. It's one of the most common childhood neurodevelopmental disorders, but not all ADHD looks the same. Some children only have difficulty with attention and organization, while others experience hyperactivity and impulsivity. And some have challenges with both sets of traits. These symptoms can be frustrating in the classroom. While it's easy to interpret them as intentional misbehavior or daydreaming, they're actually the result of brain chemistry that just works differently. Students with ADHD can also be some of the most creative and passionate contributors to your classroom. Reframing the way you look at your student and finding the right strategies to support them will encourage them to shine. Ask your student how they learn best. Some people are able to focus more when they are standing or moving around. Others find fidgets like pipe cleaners, beaded bracelets, or clay to be helpful. At times, a signal like a knock on the desk can help refocus a student's attention. Try a strategy for a few weeks and then debrief. Your student will be more invested in suggesting and trying solutions if they're part of the discussion. A complex multi-step assignment without the appropriate scaffolding can be daunting for a child with ADHD. They commonly struggle with executive function skills, like the ability to remember the sequence of steps in order to meet a goal. Start by explaining the big picture, but assign smaller work chunks with shorter deadlines to help students grasp the map of how to reach the end goal. Helping a student track projects and deadlines using a learning management system simplifies these tasks by having everything in one place. If you can't go digital, showing your student how to organize themselves with tools like agendas and to-do lists can build positive habits. Breaks benefit all students, but they are crucial for those with ADHD. You can actually increase productivity by building movement into your class, especially before asking them to work quietly. Keep your movement breaks short and structured, like a game of Simon Says or a set of 10 jumping jacks. After periods of concentration, allow students to stretch, get some water, or talk softly with a friend. Calibrating your teaching strategies to better support a student with ADHD will not only bolster your relationship, it will likely have a lasting impact on their success.
The video we watched encourages educators to ask students with ADHD, what helps you learn better? As this strengthens their relationship and school success. How would you feel having such a conversation with one of your students? What do you believe you would gain? In this video, we also saw practices such as breaking assignments into small pieces, clear steps, and movement breaks. Which of these strategies do you feel you could more easily try out in your classroom? Next, let's look at the case of student Nick. Nick is a 5th grade student diagnosed with ADHD. At school, he struggles to remain focused, frequently gets up from his seat, and does not complete his assignments. He often receives reprimands, and his classmates have begun to avoid him. The core question is this behavior a choice made by the child or a sign that he needs a different kind of support? This is exactly what the video we just watched invites us to think about. In reality, ADHD affects attention, organization, and self-regulation. It is not that Nick doesn't want to, he wants to, but he struggles. When this is misinterpreted, the child begins to experience frustration, anxiety, and low self-esteem. How can we help Nick? It is important to change the way we approach Nick. When instructions become clearer and tasks are broken down into steps, then a routine is established and things are getting better. It is also crucial to speak with the child and not just about the child. This creates a sense of security. It will help Nick start participating more, reduce tensions, and boost his confidence and self-esteem. School is no longer a threat. It becomes a place of support. Support is not a concession. It is a prerequisite for equal learning and mental health. When we change the way we perceive behavior, we change the child's entire school experience. In summary, let's look at some key messages that we want to take away from today's seminar. First of all, ADHD is not a character flaw, but a different way of working of the brain. It is not about laziness or lack of effort. Many times, even today, we hear that a child with ADHD is lazy, naughty, or indifferent. These are criticisms of character, but ADHD is not the result of character flaws. It is a neurobiological difference. Children with ADHD often have extraordinary potential. They can be incredibly creative. As educators, our job is to turn problems into opportunities. Behavior problems are a message. Behavior is a means of communication. When a child struggles and exhibits behavior problems, it is not doing it to provoke us. It is an indication that something is needed. Support protects well-being. With the right support, children are empowered, anxiety is reduced, and self-esteem and confidence are boosted. Supporting a child with ADHD doesn't require large, complicated interventions. Small changes in structure, instruction, and communication make a huge difference. In this slide, we list some resources with supporting materials, which include websites with educational materials and tools, as well as practical support strategies at home and school for parents, teachers, and professionals. In addition, we list YouTube channels and videos with relevant material. The most important thing to remember is that with the right support, children thrive. We don't need to change the child. We need to change the framework within which they are trying to learn. Thank you for your attention, and we invite you to take with you even one small change that you can implement starting tomorrow. Let's create environments where every child with ADHD can thrive. Thank you very much for your attention.